Joining me now, Dr. Paul Offit, Director of Vaccine Education Center and member of the FDA Vaccines and Related Biological Products Advisory Committee. It's good to have you back on the program, Doctor. Right now, COVID cases on the rise, school back in session. What's the public health impact, potentially, of the president now questioning the vaccine's efficacy?
Thank you, President Trump, for Operation Warp Speed. Because of that vaccine in 2021, when the vaccine became available, you were 12 times less likely to be hospitalized and 12 times less likely to die if you were vaccinated than if you weren't. The following year, it was about 6 times less likely to be hospitalized and less likely to be vaccinated, thanks to that vaccine. That vaccine, depending on whose data you look at, saved between 2 and 3 million American lives, and about 200 to 250,000 people who chose not to get that vaccine chose their own death. It was a remarkable accomplishment. I don't know what he's talking about.
Yeah, so in other words, there is no question scientifically about how successful it has been. But now the Kaiser Family Foundation reports that manufacturers Eli Lilly, Pfizer, they're worried that their production could be impacted. Is this a reality? And if so, what do we do about it within the vaccine and medical community? Are they prepared?
Yes, it is a reality. I think we have, as a Secretary of Health and Human Services, a man who for 20 years has been a virulent anti-vaccine activist and science denialist, who has said the COVID vaccines were, in his words, the deadliest vaccines ever made. He's going to do everything he can to make that vaccine less available, less affordable, and more feared. And what's going to be the consequence is that there will be people who will suffer that disease who didn't need to. This is a preventable infection. And the goal of that vaccine has been met, which is to prevent serious disease, meaning keep you out of the hospital, keep you out of the ICU, keep you out of the morgue. It's not to prevent mild or moderate illness, and I think people need to understand that.
So we mentioned that RFK Jr. is due in front of the Senate committee on Thursday. What questions would you like to see lawmakers ask him?
I'd like to ask him this question. He is now the Secretary of Health and Human Services during the biggest measles epidemic we have had in 33 years. We've had 2 children die of measles in this country, the first child death since 2003. I would like to ask him why, in the midst of this epidemic, he said on national television that the measles vaccine kills people every year, that the measles vaccine causes blindness and deafness. Why would he say that in the midst of an epidemic when it's clearly false? Why would he do something so incredibly irresponsible? And why then should he still remain as Secretary of Health and Human Services?
So then the net effect of that is some people listen, they go to the CDC website. They're getting information that's different than they would have gotten a year ago. So what needs to happen to help Americans really understand the truth about vaccines, Doctor?
It's confusing. I think where we are now is that RFK Jr. fired 17 members from the Advisory Committee of Immunization Practice who had tremendous expertise and experience and replaced them with people who, for the most part, didn't. And so now you're not getting good information from the ACIP. You're not getting good information, or you worry whether you're getting good information from the CDC, given all the recent people who have quit. So I think now what happens is people are turning to the American Academy of Pediatrics to get good information about childhood vaccines, or the American College of Obstetrics and Gynecology to get good information about vaccines for pregnant women. So it's a confusing time, and that's the point. I think Robert F. Kennedy Jr.'s goal is to make it confusing so that people will be less likely to get vaccines, all of which he considers to be unnecessarily dangerous.
Dr. Paul Offit, it is a pleasure to have you on the program to speak the truth, and we thank you so much for your time, sir.